Okay, so now I'm in conversation with Liz Ashall Payne, who is a CEO of an organisation called Orcha. And I'm going to ask Liz to tell us a little bit about herself and what Orcha does. Liz.
Thanks, David. Thank you. Yeah, so my name's Liz, and I'm the founding chief exec of Orcha. I started out my career as a speech and language therapist working in the NHS, and I worked in the NHS for around about 20 years, supporting obviously clinical practice, but also working to achieve transformational change through care pathway design to really try and get more care to patients who need that care directly. And that was really what got me interested in digital, because when I saw digital, I thought, wow, this is a real opportunity for us to get more care to our patients and populations than ever before. However, what I also saw was quite a few barriers to the uptake of digital health. The first being that people aren't aware that these products exist. The second is, where do you go to find these things, these digital health solutions? There's not a store or a shop. And the third biggest challenge is trust, and that trust isn't unfounded. So 85% of digital health solutions shouldn't be trusted, which means that if you go to an app store, you've got 85% chance of downloading an unsafe, unregulated product. So Orcha was formed and founded to support the breakdown of those barriers. And Orcha's mission is to distribute high quality digital health products. And there are a few things that we do to make sure that that happens. The first is we review, rate and approve more digital health solutions than anybody else in the world. And we do that on behalf of a number of government bodies, both here in the UK and across Europe and across the Middle East. And then what we do is we create distribution channels, so digital health portals or digital health formularies that can be used to find high quality products. And as a frontline healthcare professional, you can use that like a formulary to not only find good quality solutions, but also to recommend those products to your patient's phone via text message.
So we're talking about mainly mobile applications, or is it exclusively mobile applications that you use on your smartphone?
So that's where we started. So we started with anything that you could find on Google Play or the Apple App Store. And we have since this year added in other digital health solutions, so web-based solutions, native apps, etc.
Okay, so it's expanded beyond smartphones. I guess the demands of Orcha really maybe add even more complex dimension to all of this. So what's been happening with Orcha? Sorry, what's been happening with COVID-19? Beg your pardon.
Yes, I mean, COVID is something that we've really wanted to support and respond to. Obviously, we're not in a position to be able to be working in the front line dealing with the crisis. That's where our healthcare workers are. The bit that we're really wanting to support is to enable vulnerable communities and those self-isolating to stay as healthy and well as possible, so that frontline resources can be directed fully at the COVID crisis. And so what we've been doing is, for the thousands of products that we've already rated and reviewed, we've gone through those high quality products and identified those that can have a real impact to those vulnerable communities right now. And what we're about to launch just today on the 6th of April is our coviddigital.com site. coviddigital.com is a repository which is filled with high quality, reviewed and approved products that you can now search for. The categories that we've identified are the ones that you'd expect. So respiratory, COPD, asthma. There's a lot around mental health. So CBT replacement, anxiety, stress, depression. There's also things around maternity and pregnancy. Other long-term conditions like diabetes, areas like caring for the vulnerable and the elderly. Obviously, there's certain COVID specific products, but the critical thing about coviddigital.com is that this is founded on a review system which has clinical evidence behind each of those products. And on this site, before you hit download, there's a very clear COVID response, which details how that product can support COVID, what needs to be done to implement it, what the clinical evidence is behind it with links to any relevant clinical trials or publications, and what the cost is. Because what we're seeing is a lot of digital health products are coming forward and saying people can use their products for free at this time of crisis. And that's exactly what we're doing. We're not, this is a free to use resource. We really want to help people know which products are safe. And for healthcare professionals, they can have the upgrade code, which is Beat COVID-19, and they can then use that platform to recommend apps directly to their patient's phone. So if you know that you've got a certain amount of patients that are pregnant, you want to send them the best pregnancy app, or a certain amount of patients who've got asthma, you can send them the best asthma app. And this is really important for governance, because what we're always doing is we're not just reviewing an app once, we're continuously re-reviewing it every time that product changes. And so if you use that system to recommend an app and we find a future fault, we can do a recall.
Well, I think that's absolutely fantastic and very necessary in the current climate. As I've seen, quite a few times people promoting free COVID applications, and you really have no idea about the validity. But the ability to be able to access a service like yours that has clinical evidence and validated products is extremely important. Just a final question. What are your main types of users? Is it mainly the medical profession who are using your platform, or do you have a lot of patients?
Yes, it's a range actually. Since the COVID crisis, actually we've had more end users using the sites. What we do at Orcha is we're not just about having one platform. What we do is we work locally, either with an individual hospital or with a region or with a commissioning group, and they have their own branded app libraries that they promote to their populations and patients. And what we see there is a huge swell of people and patients using these local distribution channels to search for and find high quality products. And since COVID, we've had a huge amount of feedback actually from patients and people to say thank you, because they've been able to now find a good quality product that's really helping them to manage their own health. Now for the COVID digital.com, the reason we've just put it into one repository is because we want to offer this to anybody wherever they be in the world, and that's to support end users predominantly. But what we also know is that the healthcare professional, if they can use the resource to recommend products, people are more likely to then go on and use it because it's their healthcare professional that's recommended it to them. And what we find is that healthcare professionals really want to be able to do that, particularly right now when they can't see patients face to face.
Yes, that's very important. Well, thank you very much for sharing that information with me, Liz. This recording is going to be published on YouTube, and it will be helpful in not only promoting the conference, but also letting people know about these new fantastic services that you're able to offer. So thanks once again, and I look forward to your participation as a panelist on Wednesday.